Hello and welcome to the latest edition of Here for Good, where we explore how transformational leaders create a positive impact on the world around them. Throughout history, inspirational leaders and organizations have always used the power of words to connect with emotion, galvanize communities, and enlist others in causes for change and good. At Virtua Health, we are changing the way people think and talk about health and well-being. So it is our privilege to tee up meaningful conversations with engaging social catalysts and thought leaders. Please welcome our host, Dennis Pullin, President and CEO of Virtua Health, as he sparks today's exciting conversation.
The coronavirus pandemic continues to dominate our lives. The number of cases is drastically rising across the country, and quarantines and social distancing has become standard procedure for most of us. Yet, even as we come to know more about this virus and its impact, we find that there is still a great deal of uncertainty. And maybe that's why my most recent conversation with Dr. Martin Topiel, the head of infectious diseases at Virtua Health, proved to be our most popular episode to date. With nearly 36 years of experience advising health professionals on everything from influenza and Lyme disease to anthrax, SARS, Ebola, and now COVID-19. He guides many decisions as he lends his expertise and knowledge to help us navigate these uncertain times. Dr. Topiel, welcome back to Here for Good.
Great to be here, Dennis, and really enjoyed our conversation.
So, Marty, part of the early challenges with the coronavirus involved testing. Can you talk about some of the innovations we've seen in terms of rapid testing and what these innovations mean for how we can deal with the pandemic?
Well, that's really the challenge for us now. It was the challenge for us when we started back in January, February, and it's not evolving to the extent I'm sure that we'd all like to see. Right now, the type of testing we see is something called PCR testing, which measures genetic material of the virus. And we're used to having that kind of PCR testing for various types of infectious diseases, various types of viruses or Clostridium difficile. But what we're seeing in the innovation is the rapidity of the test, which can now be down to 5 minutes. But the problem is we haven't been able to disseminate the testing platforms, the amount of media required for the urgency of our situation.
But Marty, with these rapid tests, do we lose anything in terms of its accuracy, in terms of diagnosing the disease?
Well, we really haven't gained any extra knowledge about these PCR tests. What we do know is they're not 100% perfect. And that's increasingly clear to us when we have patients in the hospital, when we make clinical evaluations on the patients, where we feel almost certain that a patient has a disorder, but we can't verify it from the test.
So as we see the number of confirmed cases continue to increase, so does the number of people who have recovered from the virus. What can we learn from those who've recovered? Have they developed antibodies against the virus, and for how long?
The idea of what this virus is still the enigma of all how we're taking care of patients. Patients are presenting with all sorts of different manifestations, most commonly cough or low-grade fever, but we are seeing patients who have cardiac manifestations, gastrointestinal manifestations, and we're still learning about that. And similarly, we're learning about how is their immune system responding. It appears some people have a vigorous response. In fact, there's some data that shows that younger people may not have as vigorous a response. So we don't know quite as yet as to what is immunoprotective. And that's really what we have to learn going forward.
Is there the possibility of someone that has tested positive, demonstrated signs and symptoms, recovered? What's the likelihood of them catching it again?
Well, that's really the $64 million question. And we don't know the answer to that. The level of protective antibody is still not clear. We still, we have two different types of antibodies generally in response to viral infection. There's the IgM type, which is the early antibody, and the one called IgG, which is the later antibody. Uh, we don't know the level, the quantity of level required for somebody to feel comfortable and be immune. We also don't know how long that would last for. And that's where we are studying things right now.
Is it easy to get the tests for antibodies? Are they commercially available?
There's one test that's been approved to date, but for the most part, they're still undergoing approval by the FDA. Many are in experimental mode. Some are going phase 2, phase 3 clinical studies. We certainly hope those come out, and it'll probably be some combination of antibody testing with the PCR testing that influences how we go about opening up our country.
So, over the course of the last several weeks, we've seen changes in everything from predictions on the spread of the virus to the need to self-quarantine to recommended protective measures. Is it unusual for the guidelines to change so frequently? And how can people sort through all of this?
And I'm trying to keep up with this as well, Dennis. It's an incredible challenge. I think what we're seeing is first the recommended medical measures from a public health point of view, and then dealing with the reality of, gee, how much PPE is available as a country and or how much staffing is available. And the CDC has given various options when maximum PPE is available and an alternative guideline as to when PPE shortage exists. So it gives us a template to work off, but it's certainly unusual to have these changing structures. And it's very hard for the staff and the physicians to understand how this moving target can exist. And it's our job to try to educate people to say, yeah, we're following the guidelines and we're trying to manage safety and public health at the same time.
But I would think that that in of itself would add to the tremendous amount of stress that the frontline people are already on with these changing protocols.
I would totally agree with that. It's they're challenged with being on the front line, trying to keep up on a daily basis while caring for the patients. And we have to, as I've said before, be the source of truth. And if it appears that, gee, we've changed our answers, we've made a new guideline, that source of truth becomes of less confidence. So it's up to us to really communicate why these issues are changing.
That's a tough one, though, because you want people to continue to pay attention and to be aware of the constant flow of communication. But as it changes so rapidly, it makes it difficult for people to know exactly, as you said, where that source of truth is coming from. You know, there's been a lot of examples of resourcefulness around this pandemic, from nurses figuring out how to use longer tubing to keep equipment in the hallways such that they don't need to go into the rooms as often, to different sanitizing methods that are being developed to safely reuse masks and face shields. Are these desperate measures, or do you see them as innovation at its best?
I guess I would see them as a combination. I see this innovative approach to medicine as reinvigorating medical care as much as we're challenged. I've heard people tell stories how the healthcare personnel, the physicians in the last 20 years, things had become so much regulated and with so many guidelines that people haven't been able to use their creativeness to take care of patients. When we had HIV, it was a challenge. We didn't know all the answers at the time. And going back years ago, whether it was a polio epidemic, we were challenged. You couldn't just check a box and order a CAT scan and get an answer. Uh, I think all this brings excitement in an unusual way to the caregivers, to be challenged to take care of the patient, to use video equipment, to use creative approaches. So I think it's a little bit of both in the end.
But what about for the lay population that we see on one hand, oftentimes people are encouraged to do just about anything to shield their faces, either through scarves or cloth masks and things of that nature. What do you think about that?
Well, I think everybody's trying to participate in a way that they can protect themselves and at the same time offer themselves as a helping hand to those patients who are so alone. This is the sadness of this infection. But I think in the end, people mean well. They've been asked to preserve PPE, so they're coming up with innovative approaches. And I think the challenge is that we all understand how to do this in a safe way and at the same time lend ourselves to taking care of the patients and make it very humanistic.
Marty, you and I haven't talked about this, but what about, we're hearing a lot about certain populations being more at risk. We've often talked about the elderly. We've talked about those that have pre-existing conditions. And recently, I've heard a lot about the African American community. Any thoughts as to why a certain population may be at higher risk as opposed to others?
Yeah, I think, our minds are so open and we learn about what society is so about here. Personally, when I get on the phone with the emergency room and I hear some sad tales about a family where the wife was sick the day before and may have died, and now the husband comes in 2 days later into the emergency room, you feel such sadness for that situation. And similarly, I think looking at the population in total, we see those areas where there's density, where people are working in certain industries. Uh, it becomes an infection that not everybody is equally afflicted. And we see how people are on lines at food banks. This is a challenge that in our lifetime we haven't come to understood. As I've said, we are not an invulnerable country, and we do have different groups that are at higher risk. Again, those that have a density within urban areas where they're still asked to come to work and not allowed a distance. And then on top of that is those underlying illnesses of diabetes that we don't totally understand the genetics of, but the social determinants in combination with those medical problems, we are still have to learn about that. And I guess we can hope that this takes us in a direction that we can really take care of everybody in the future.
I think one of the questions that's on everyone's mind is, when will this end? But even when we are past this initial batch of cases, I'm hearing there may be a second wave. What does this mean, and what sort of impact can we expect?
Well, it's really interesting. We're seeing how the flattening of the curve may actually have a low level of infection for a number of months. And then whether a second wave maybe appears in the fall as a new spike, as people gather together, that's certainly what we want to try to prevent with new diagnostics, with new vaccinations. But that's what we saw in the Spanish flu in 1918. We saw 3 waves. So, I think the goal right now is how do we maintain this low level plateau where there will be some infections present, and then get it to the point where we never have that second wave.
But we hear a lot about as we start to talk about opening up the nation when this is hopefully behind us, what type of surveillance do you think needs to be put in place for those that either have the antibodies, those that may be still very at risk of this second wave? Do you see any type of surveillance that you are aware of that we may want to put in place to start monitoring folks as they go back to work?
I think that's the magic question, Dennis. And I think we need to be creative and we need to go big. Uh, when historically our country goes to war, one of the things we learned about is you can't put half of the troops in an area to fight a war. And we learned that from Vietnam. And I see us as having to go big on this. And it's not just testing, but it's testing and retesting to a point where we need an army of people and repurposing our country to be able to do that. I mean, this is a war with an invisible enemy. We're going to need a large amount of public health personnel and ongoing diagnostic testing so that when you go in your work environment, you know the person next to you is safe and you're safe. And I just see this as almost like a weekly test that we go through. Um, and that's what it's going to take. It's going to take repurposing our country.
And you don't think that that would be considered a violation of HIPAA, or do you think something of that nature sort of goes well beyond that because it's a public health crisis that we're dealing with?
Yeah, I mean that is the challenge. Where is public health critical for all of us to move forward, and where does it impinge on our freedoms? We're hearing a lot now how in other countries people have been monitored on their movements, and I'm hearing that there's a lot of talk about that being engaged in our phones moving forward, geographically monitoring people who are infected. Um, I think that's why leaders of the country, CEOs of health systems, they're going to have to help take us there to that level. Um, yeah.
And I agree with you. So tell me, what is the most commonly occurring question you get from healthcare professionals, and what is the most commonly asked question you get from the general population or from patients?
Right. I think the most common question from the healthcare worker is, how do I know if I'm infected? What does it mean if I take a test? And does that mean, if it's positive, that I'll never get infected again? And what the literature is showing now is just very unclear answers. Right now in South Korea, they found 91 people who previously were infected and have become positive tests again. And we don't know if that's a new infection or a reinfection or recurrence of infection. So the whole testing question has become still very unclear. And I think that's what it's on healthcare workers' minds. And I'm not sure the general population is much different than that. It becomes confusing. They don't have access. And I think they're incredibly appreciative when they have avenues of telemedicine or even just a phone call to just get some access.
So back to your comment about being reinfected, is this a type of virus that potentially could go dormant in the body and then suddenly re-emerge at a later date or a later point within a certain time frame?
Well, I think we're learning that. We're trying to understand that. Certainly, there are other infections that have done that in the past, such as tuberculosis. That's how it operates. More likely, this virus has, if it's persisting, it has a low level that just the immune system never totally eradicates. And that's why when we started our conversation, what is the level of antibody required? What is immunoprotective? That's what we have to study right now, and that's what the scientists are looking at.
So at some point, this pandemic hopefully will be behind us. What sort of lessons will we have learned about the way our society functions that may help us avoid such a dramatic impact, perhaps from a new virus?
Uh, I think we're going to be a different society, Dennis. I think the way we communicate with people, we see much more use of technology. I think the workplace will be revolutionized. And I think we're going to take ourselves with a sense of more purpose, a sense of friendship, of kinship. I hope that's the lesson we learn from that.
So, what suggestions or recommendations would you have for someone like myself? A moment ago, you mentioned our health system leaders. So, if you had an opportunity to advise me on things that I could do to help position us to better combat this, what would it be?
Well, I think the two things are I have a different phrase testing, testing, and retesting, because I think that's giving people the confidence and the safety. So we have to work with our government in making sure those tests are available. Communication and education is going to be key for all our staff to understand what the goals and what our purposes are. And I think as a CEO, you're the one who's going to be out in front and leading that charge, because it's from the highest person in the organization to everybody else who's working hard has to have that confidence.
Point well taken. So let's fast forward maybe a year or so. We now have a vaccine for this. Do you think people will get vaccinated, or do you think we'll still struggle with sort of getting traction to help us deal with this? Sort of like what we did with the flu vaccine. It wasn't so quickly adopted as we had hoped.
Yeah, that's a tremendous question you're bringing up. The flu vaccine is not 100%. It's certainly very helpful, but it's varied anywhere from 30 to 70% in its effectiveness. And we've had other vaccines, some of which are extremely effective, but it's had some antagonism from some groups in the public. So we have to prove if we have a vaccine that it's safe, and that's why it takes 18 months to understand the safety and the efficacy of vaccines. I don't think we can count on the vaccine 100%, but what I do go back to is when we had HIV infection, in really a relatively short amount of time, we developed medication to be able to fight that infection that seems so overwhelming. So I have faith in our scientists, and I think we will have a vaccine, but we will have to work together to be able to use it effectively.
You mentioned medications that were developed actually to treat HIV. And we've been using some of those, or some of those very medications have been talked about, the antivirals to treat the COVID-19. And there are many others that are being sort of rushed to market or rushed to understand to see if they would be viable treatment therapies. Any thoughts about where we are with that, or is there anything on the horizon that you think has a greater potential to be put forth sooner than later?
Yeah, that's a really interesting question. Right now, our Infectious Disease Society of America just put out guidelines. And the unfortunate thing about the treatment guidelines is they've basically said, we don't know the answers to this. We're going to try to do clinical trials to understand the medications. Uh, And what we're doing is we are using some medicines for off-label purposes, such as we know about Plaquenil and azithromycin, which have been proposed in our government circles, but understanding at the same time the potential adverse reactions, so we're being good clinicians about it. But I think, as you're kind of intimating, the medications we're trying ultimately will get refined enough, and probably not only will it be valuable for us in using it for COVID-19, but we'll learn so much about medicines, we'll be able to use it with other disease systems and other disorders that ultimately it'll probably help us improve our patient care in general.
Is the flow of information coming out of China better these days in terms of what they have found to be effective in treating the disease?
We are getting some data from China, but I think there's still a lot withheld. There's a lot of international information coming from France and Italy. And in fact, one of the places I access to receive all this information, frankly, is social media. And we have to, of course, sift through what we think is real information. But it seems like that's a good mechanism to be able to accumulate the information from a worldwide source.
So once again, you have an opportunity to be the single source of truth. If you were going to provide a piece of advice for our listeners at this point, what would it be?
Well, I think we're starting to understand the science a little bit. We can get there. We can get to the other side of this story. There have been many sacrifices by our ancestors not too long ago during World War II, where they gave up their time and we all repurposed. And I see our healthcare staff, brave and courageous, doing that, gained a whole different purpose for what their existence is. And I think we just have to take that on as a country and give people the confidence that we can get there.
Well, Marty, once again, you've provided great insight and clarity into this pandemic and its impact. Thank you for sharing your expertise with our listeners on Here for Good, and thank you and your colleagues on the front line for helping us get through these difficult times.
Thanks, Dennis. Really appreciate it.
Thank you for joining us for this episode of Here for Good. If you liked what you heard, please leave us feedback and share our podcast link with others. Until next time, be well, everyone.